RICER is rest, ice, compression, elevation, and then referral if it doesn't start to get better. Now, RICER is a treatment for all soft tissue injuries. The basic goal of RICER is to decrease inflammation because you don't want any further damage in the area that's been injured being caused by inflammation. So if you get too much fluid in that area, it starts to expand too much and then it causes further damage to cells. It's kind of like if you inflate a balloon too much, it pops. And so if you get too much inflammation into your cells, they start to bust. Now, your cells are pretty small, and so you want your inflammation to be controlled. You need inflammation for healing and for recovery, but you also want to manage it so it's not too much of it, too much inflammation. The other thing that some of it's doing is decreasing the pain. So ice helps to reduce pain as well.